41. A patient with COPD is prescribed a long-acting beta agonist, LABA. What should the nurse teach? A. Use it only during acute exacerbations. B. Take it daily to maintain airway patency. C. Expect sedation as a side effect. D. Stop it if symptoms improve. Answer: B. Take it daily to maintain airway patency. Rationale: LABAs are used daily for maintenance. Option A is incorrect as they are not for acute use. Option C is incorrect as sedation is not a side effect. Option D requires medical guidance. 42. A patient with COPD has an ABG showing pH 7.38, PaCO 250 mm of mercury, HCO 330 milliequivalent/L. How should the nurse interpret this? A. Metabolic acidosis, partially compensated. B. Respiratory alkalosis, uncompensated. C. Respiratory acidosis, fully compensated. D. Metabolic alkalosis, compensated. Answer: C. Respiratory acidosis, fully compensated. Rationale: elevated PaCO 2 indicates respiratory acidosis, with normal pH and elevated HCO 3 suggesting full compensation. Option A is incorrect as the issue is respiratory. Option B is incorrect as pH is not alkalotic. Option D is incorrect as it is not metabolic. 43. A patient with COPD is anxious about their condition. What is the most therapeutic response? A. Anxiety will make your breathing worse. B. Let's discuss what concerns you about your COPD. C. You should focus on positive thoughts. D. Don't worry, you'll get used to it. Answer: B. Let's discuss what concerns you about your COPD. Rationale: this response encourages therapeutic communication. Options A, C, and D are dismissive. 44. A patient with COPD is prescribed ipratropium. What should the nurse teach? A. Expect a dry cough as a side effect. B. Take it daily to reduce airway resistance. C. Use it as needed for acute dyspnea. D. Rinse the mouth after use. Answer: B. Take it daily to reduce airway resistance. Rationale: ipratropium is used daily to reduce airway resistance. Option A is incorrect as dry cough is not common. Option C is incorrect as it is not a rescue medication. Option D is incorrect as rinsing is not required. 45. Which finding in a patient with COPD indicates respiratory failure? A. Oxygen saturation of 89%. B. Respiratory rate of 20 breaths/min/c. PaCO 2 of 65 mm of mercury. D. Clear sputum production. Answer: C. PaCO 2 of 65 mm of mercury. Rationale: elevated PaCO 2 indicates CO2 retention, a sign of respiratory failure. Option A is typical for COPD. Option B is normal. Option D is normal. 46. How should the nurse prevent nasal dryness in a patient with COPD on oxygen therapy? A. Apply petroleum jelly to the nares. B. Encourage mouth breathing. C. Use a humidifier with the oxygen system. D. Reduce oxygen flow to 1 liter per minute. Answer: C. Use a humidifier with the oxygen system. Rationale: a humidifier prevents nasal dryness by adding moisture. Option A is unsafe due to flammability. Option B is ineffective. Option D may cause hypoxemia. 47. Which strategy promotes energy conservation for a patient with COPD? A. Perform all activities in the morning. B. Avoid using assistive devices. C. Use a shower chair during bathing. D. Increase physical activity daily. Answer: C. Use a shower chair during bathing. Rationale: a shower chair reduces energy expenditure. Option A causes fatigue. Option B is incorrect as assistive devices help. Option D is too strenuous. 48. Why does a patient with COPD need an annual flu vaccine? A. It improves your lung function. B. It prevents all respiratory infections. C. It reduces the risk of flu-related exacerbations. D. It decreases mucus production. Answer: C. It reduces the risk of flu-related exacerbations. Rationale: The flu vaccine reduces influenza risk, a common exacerbation trigger. Option A is incorrect, as it does not improve lung function. Option B is incorrect, as it does not prevent all infections. Option D is incorrect, as it does not affect mucus. 49. Why is a high-protein diet prescribed for a patient with COPD? A. Reduce airway inflammation. B. Support muscle repair and maintenance. C. Prevent fluid retention. D. Decrease oxygen requirements. Answer: B. Support muscle repair and maintenance. Rationale: a high-protein diet supports muscle maintenance in COPD. Option A is incorrect, as diet does not reduce inflammation. Option C is unrelated. Option D is incorrect, as it does not affect oxygen needs. 50. Which laboratory value should the nurse monitor closely in a patient with COPD during an exacerbation? A. Serum sodium. B. Arterial blood gas, ABG. C. Serum creatinine. D. White blood cell count. Answer: B. Arterial blood gas, ABG. Rationale: ABGs provide critical data on oxygenation and CO2 levels. Option D is relevant for infection, but less urgent. Options A and C are not directly related. 51. Which action by a patient with COPD using a metered-dose inhaler, MDI, indicates incorrect technique? A. Inhaling slowly and deeply. B. Actuating the inhaler during exhalation. C. Holding breath for 10 seconds after inhalation. D. Shaking the inhaler before use. Answer: B. Actuating the inhaler during exhalation. Rationale: actuating during exhalation prevents medication from reaching the lungs. Options A, C, and D are correct techniques. 52. A patient with COPD reports feeling depressed. What is the most appropriate response? A. Try to focus on the positive aspects of your life. B. Depression is common and will pass. C. Can you tell me more about what's making you feel this way? D. You should avoid thinking about your condition. Answer: C. Can you tell me more about what's making you feel this way? Rationale: this encourages therapeutic communication. Options A, B, and D are dismissive. 53. A patient with COPD is receiving a nebulized bronchodilator. What should the nurse ensure? A. The medication is stored in the nebulizer. B. The nebulizer is cleaned after each use. C. The patient inhales rapidly during treatment. D. The treatment lasts for 20 minutes. Answer: B. The nebulizer is cleaned after each use. Rationale: cleaning prevents infection and ensures function. Option A is incorrect, as medication should not be stored. Option C is incorrect, as inhalation should be slow. Option D is incorrect, as treatments last 5 to 15 minutes. 54. A patient with COPD has a PaO2 of 60 mm of mercury and PaCO2 of 55 mm of mercury. What is the priority intervention? A. Administer a diuretic. B. Encourage vigorous coughing. C. Administer oxygen at 1 to 2 liters per minute. D. Administer a high-dose corticosteroid. Answer: C. Administer oxygen at 1 to 2 liters per minute. Rationale: a PaO2 of 60 mm of mercury indicates hypoxemia, and low-flow oxygen is the priority. Option A is not indicated. Option B may worsen dyspnea. Option D is secondary. 55. Which instruction is most important for a patient with COPD to avoid exacerbations? A. Use a bronchodilator before meals. B. Get vaccinated for pneumococcus and influenza. C. Avoid outdoor activities entirely. D. Increase fluid intake to 3 L/day. Answer: B. Get vaccinated for pneumococcus and influenza. Rationale: vaccinations prevent infections that trigger exacerbations. Option A is incorrect, as bronchodilators are used as needed. Option C is incorrect, as moderate activity is beneficial. Option D is not necessary unless indicated. 56. A patient with COPD is admitted with a respiratory rate of 30 breaths/min and oxygen saturation of 88%. What is the first action? A. Encourage coughing and deep breathing. B. Administer a rescue inhaler. C. Apply oxygen at 2 liters per minute via nasal cannula. D. Notify the healthcare provider. Answer: C. Apply oxygen at 2 liters per minute via nasal cannula. Rationale: an oxygen saturation of 88% indicates hypoxemia and low-flow oxygen is the priority. Option A may worsen dyspnea. Option B is secondary. Option D is premature. 57. What is the purpose of a peak flow meter for a patient with COPD? A. Measure oxygen saturation. B. Monitor respiratory rate. C. Assess airway obstruction. D. Evaluate mucus clearance. Answer: C. Assess airway obstruction. Rationale: a peak flow meter measures peak expiratory flow rate, indicating airway obstruction. Option A is incorrect, as it does not measure saturation. Option B is incorrect, as it does not monitor respiratory rate. Option D is incorrect, as it does not evaluate mucus clearance. 58. A patient with COPD reports increased shortness of breath after using a cleaning product. What should the nurse advise? A. Increase oxygen flow during cleaning. B. Avoid exposure to the cleaning product. C. Use a bronchodilator before cleaning. D. Continue using the product in a well-ventilated area. Answer: B. Avoid exposure to the cleaning product. Rationale: chemical irritants exacerbate COPD symptoms. Avoidance is key. Option A is inappropriate without orders. Option C is not preventive for irritants. Option D is incorrect, as exposure may still cause symptoms. 59. A patient with COPD is prescribed fluticasone/salmeterol. What should the nurse teach the patient to do after use? A. Take a deep breath and cough. B. Rinse the mouth with water. C. Check peak flow immediately. D. Use a spacer for the next dose. Answer: B. Rinse the mouth with water. Rationale: rinsing prevents oral candidiasis from fluticasone. Option A is unnecessary. Option C is unrelated to post-inhaler care. Option D is incorrect, as spacers are used during administration. 60. Which finding suggests an acute exacerbation in a patient with COPD? A. Clear lungs sounds bilaterally. B. Increased sputum production and dyspnea. C. Normal respiratory rate of 18 breaths/min. D. Stable oxygen saturation of 90%. Answer: B. Increased sputum production and dyspnea. Rationale: increased sputum and dyspnea are signs of an exacerbation. Option A is unlikely in COPD. Option C is normal. Option D is typical for COPD. 61. Which safety precaution should the nurse emphasize for a patient with COPD on oxygen therapy? A. Store oxygen tanks horizontally. B. Avoid smoking near oxygen. C. Keep oxygen tanks near a radiator. D. Use wool blankets. Answer: B. Avoid smoking near oxygen. Rationale: smoking near oxygen is a fire hazard. Option A is incorrect, as tanks should be upright. Option C poses a fire risk. Option D is unnecessary. 62. A patient with COPD is prescribed roflumilast. What should the nurse monitor for? A. Hyperglycemia. B. Weight loss. C. Bradycardia. D. Increased sputum production. Answer: B. Weight loss. Rationale: roflumilast can cause weight loss. Options A, C, and D are not primary side effects. 63. Which goal is most appropriate for a patient with COPD? A. Eliminate all respiratory symptoms. B. Maintain oxygen saturation above 88%. C. Reverse airway obstruction. D. Achieve normal oxygen saturation of 98%. Answer: B. Maintain oxygen saturation above 88%. Rationale: maintaining oxygen saturation above 88% is realistic for COPD. Option A is unattainable. Option C is impossible, as obstruction is irreversible. Option D is unrealistic. 64. A patient with COPD reports chest pain during inspiration. What should the nurse suspect? A. Chronic bronchitis exacerbation. B. Pulmonary embolism or pneumothorax. C. Muscle strain from coughing. D. COR pulmonale. Answer. B. Pulmonary embolism or pneumothorax. Rationale. Inspiratory chest pain suggests pneumothorax or pulmonary embolism. Option A does not cause inspiratory pain. Option C is less likely. Option D is unrelated to chest pain. 65. What is the primary benefit of diaphragmatic breathing for a patient with COPD? A. Increases mucus clearance. B. Reduces work of breathing. C. Prevents bronchospasm. D. Improves oxygen uptake. Answer. B. Reduces work of breathing. Rationale. Diaphragmatic breathing strengthens the diaphragm, reducing breathing effort. Option A is incorrect, as it does not primarily clear mucus. Option C is incorrect, as it does not prevent bronchospasm. Option D is a secondary benefit. 66. A patient with COPD is prescribed a short-course corticosteroid. What should the nurse teach? A. Take it on an empty stomach. B. Taper the dose as prescribed. C. Stop the medication if symptoms improve. D. Take the medication indefinitely. Answer. B. Taper the dose as prescribed. Rationale. Tapering prevents adrenal suppression. Option A is incorrect, as corticosteroids can be taken with food. Option C causes withdrawal. Option D is incorrect, as long-term use is avoided. 67. A patient with COPD is receiving mechanical ventilation. What is the priority assessment? A. Skin integrity. B. Airway patency. C. Fluid intake. D. Blood pressure. Answer. B. Airway patency. Rationale. Airway patency is critical in mechanically ventilated patients. Options A, C, and D are secondary. 68. Why does a patient with COPD need a pneumococcal vaccine? A. It decreases mucus production. B. It improves lung capacity. C. It reduces the risk of pneumonia. D. It prevents all respiratory infections. Answer. C. It reduces the risk of pneumonia. Rationale. The pneumococcal vaccine reduces pneumonia risk. Option A is incorrect, as it does not affect mucus. Option B is incorrect, as it does not improve lung capacity. Option D is incorrect, as it does not prevent all infections. 69. Which finding supports a diagnosis of COR pulmonale in a patient with COPD? A. Decreased respiratory rate. B. Jugular vein distension. C. Hypotension. D. Clear lung sounds. Answer. B. Jugular vein distension. Rationale. Jugular vein distension indicates right-sided heart failure, COR pulmonale. Option A is incorrect, as respiratory rate is usually increased. Option C is incorrect, as hypertension is more common. Option D is unlikely in COPD. 70. A patient with COPD is using a dry powder inhaler. What should the nurse teach? A. Rinse the mouth after each use. B. Inhale quickly and forcefully. C. Use a spacer with the inhaler. D. Hold breath for 5 seconds after inhalation. Answer. B. Inhale quickly and forcefully. Rationale. Dry powder inhalers require quick, forceful inhalation. Option A is incorrect unless a corticosteroid is included. Option C is incorrect, as spacers are not used. Option D is incorrect, as 10 seconds is recommended. 71. A patient with COPD is anxious and tachypneic. What is the best intervention? A. Administer a sedative. B. Teach pursed lip breathing. C. Encourage rapid, deep breathing. D. Increase oxygen to 5 liters per minute. Answer. B. Teach pursed lip breathing. Rationale. Pursed lip breathing reduces tachypnea and anxiety. Option A may depress respiration. Option C worsens symptoms. Option D risks suppressing the hypoxic drive. 72. A patient with COPD is prescribed a leukotriene modifier. What should the nurse monitor for? A. Blood glucose. B. Liver function. C. Heart rate. D. Oxygen saturation. Answer: B. Liver function. Rationale: leukotriene modifiers can affect liver function. Options A, C, and D are not primary monitoring needs. 73. Which environmental trigger should a patient with COPD avoid? A. Warm temperatures. B. Dust and pollen. C. Moderate exercise. D. Low humidity. Answer: B. Dust and pollen. Rationale: dust and pollen irritate airways, triggering exacerbations. Option A is not a primary trigger. Option C is beneficial in moderation. Option D may be managed with humidification. 74. A patient with COPD is admitted with an oxygen saturation of 85%. What is the first action? A. Administer a bronchodilator. B.
Position the patient supine.
C. Apply oxygen at 1 to 2 liters per minute via nasal cannula. D. Encourage coughing to clear airways. Answer: C. Apply oxygen at 1 to 2 liters per minute via nasal cannula. Rationale: an oxygen saturation of 85% indicates severe hypoxemia and low-flow oxygen is the priority. Option A is secondary. Option B increases dyspnea. Option D may worsen dyspnea. 75. A patient with COPD is receiving antibiotics for a respiratory infection. What indicates effective treatment? A. Increased sputum production. B. Elevated white blood cell count. C. Decreased fever and sputum clarity. D. Increased respiratory rate. Answer: C. Decreased fever and sputum clarity. Rationale: decreased fever and clearer sputum indicate infection resolution. Option A suggests worsening infection. Option B indicates ongoing infection. Option D suggests distress. 76. Why is a bronchodilator prescribed for a patient with COPD? A. It reduces airway inflammation. B. It opens airways to ease breathing. C. It increases oxygen production. D. It thins mucus secretions. Answer: B. It opens airways to ease breathing. Rationale: bronchodilators relax airway muscles, improving airflow. Option A is incorrect, as they do not primarily reduce inflammation. Option C is incorrect, as they do not affect oxygen production. Option D is incorrect, as they do not thin mucus. 77. Which finding in a patient with COPD indicates hypoxia? A. Oxygen saturation of 90%. B. Restlessness and confusion. C. Respiratory rate of 20 breaths/min. D. Productive cough. Answer: B. Restlessness and confusion. Rationale: restlessness and confusion indicate hypoxia. Option A is typical for COPD. Option C is normal. Option D is common but not urgent. 78. What is the best exercise recommendation for a patient with COPD? A. Sprinting for 30 minutes daily. B. Walking for 20 minutes 3 times a week. C. Heavy weightlifting daily. D. Swimming in cold water. Answer: B. Walking for 20 minutes 3 times a week. Rationale: moderate walking improves endurance without overexertion. Options A, C, and D are too strenuous or may trigger symptoms. 79. What is the benefit of using a spacer with an inhaler for a patient with COPD? A. Reduces the need for multiple doses. B. Improves medication delivery to the lungs. C. Prevents side effects like thrush. D. Increases the speed of inhalation. Answer: B. Improves medication delivery to the lungs. Rationale: a spacer enhances medication delivery by reducing oral deposition. Option A is incorrect, as it does not reduce dosing. Option C is incorrect, as rinsing prevents thrush. Option D is incorrect, as it does not affect inhalation speed. 80. A patient with COPD reports shortness of breath at rest. What is the first action? A. Administer a rescue inhaler. B. Assess oxygen saturation. C. Encourage deep breathing exercises. D. Notify the healthcare provider. Answer: B. Assess oxygen saturation. Rationale: assessing oxygen saturation determines the severity of hypoxia. Option A is premature. Option C may worsen symptoms. Option D is premature.